apa Hana? Itu coba. أصبح إيه؟ وصل محمد بقى. يا كفو أرد لا
We'll continue with stage 1, paper 1. Right? So Haemophilus influenza does not cause meningitis, cellulitis, otitis media, or gastroenteritis. We know H. influenza is responsible for GI. I'm not sure of cellulitis. What do you guys think?
Me, based on the choices, I'd go with gastroenteritis, because some gram-negative organisms, such as Haemophilus, they've been known to cause some skin infections.
Oh, okay. And what about otitis media?
Otitis it causes, Haemophilus, influenza, and Streptococcus pneumonia. Those are two brothers. They get into mischief pamoja. So whatever strep pneumonia causes, even influenza follows it. So it causes otitis media, meningitis. Yeah.
So what else can we recall about this microorganism?
We were referring to it as a gram-negative coccobacilli.
Gram-negative coccobacilli is the one that causes, we said yesterday, community acquired pneumonia, right?
Yeah. It can cause community acquired pneumonia, same like strep.
What else?
Non-motile. Okay, you're saying they are non-motile.
Non-motile. Facultative anaerobes. Anyone wants to add anything? The most common causes of UTI infection is Escherichia coli, Streptococcus pneumonia, Brucella abortus, or Chlamydia trachomatis.
E. coli.
E. coli. Yes, I was going to say the same. E. coli. And also from the Staphylococcus, one of them is, I can't remember which one. Staphylococcus. There's one of them.
Yes.
Sorry?
The Staphylococcus saprophyticus.
Yes, yes. Which other organisms can cause UTI?
I think we also have the Proteus mirabilis.
Proteus?
Mirabilis.
Something like that.
Mirabilis. Mirabilis. But, yeah, stuff.
What did you say? Just Staphylococcus?
Saprophyticus.
Saprophyticus, yeah.
Yeah.
Klebsiella is involved in this also.
Klebsiella, I'm not sure. But I know also, Danny. The one Dr. Karimi told us, Enterococcus fecalis.
Yes, also Klebsiella is involved in UTI. It's part of Enterobacteriaceae, and it also causes UTI.
And anyone think, okay, what else can we cover on this?
Maybe someone can tell us treatment of UTI.
Yes.
Empirical treatment. And also the signs and symptoms also, yeah.
Let's start with signs and symptoms.
Yeah.
The common one is obvious, can't fail, is fever, chills, pain while peeing is called. What is it called?
Dysuria.
Dysuria.
Yeah. So for the fever and chills, that suggests that the infection has gone up to the kidney, that it's now pyelonephritis. When it's just in the bladder area, it's just usually there is no fever or chills, usually. The urgency and frequency. Feeling like you want to go to the loo every now and then, and also actually going to the loo every now and then.
Yeah, maybe to add something little is when you're classifying the urinary tract infections, you classify them basing on either the anatomical presentation or anatomical location, and also using the epidemiology. So when you're using the anatomical presentation, you will have the lower tract infections, whereby when you talk of the lower tract infections, there are those conditions which will be affecting the bladder, specifically the urethra and prostate and epididymis if it's males. But now when you talk for the upper, it will have affected the things like the kidney in general. So it will be something like pyelonephritis. And for the presentation of the upper tract infection, you expect the frank pain, the intercostal pain, apart from the other, as Dr. And said Monen. Thanks.
Thank you. Thank you.
I think, yeah, someone else now can give us treatment. You know, all these people are working locums. They must have treated a UTI at some point. They can give us the treatment they gave.
Mwambie unatumia gani?
Yenye ulinipea mzae.
Niliambiwa ulikuwa navyo.
Anyone wants to try on treatment?
I'm not
Of
sure.
UTIs?
Cipro.
Yeah, the broad spectrum, the beta lactams.
Yeah, the beta lactams, yeah, something like amoxicillin with clavulanic. But that one majorly is for pregnancy. Let's say a person is not pregnant. Yeah, fluoroquinolones, the cotrimoxazole, and the nitrofurantoin also. Those are the first line. Fluoroquinolones, cotrimoxazole, nitrofurantoin.
So also for something like non-gonococcal arthritis, because for male you'll have the males having something like arthritis, which is also a UTI, azithromycin also works even for like pregnant women whom we are not supposed to give fluoroquinolones because of issues of the baby, the fetus malformation because of the bones. Also azithromycin is used.
What
Anything
of
else?
Also,
what
yeah, go.
Yes, somebody was talking.
can you give someone fluconazole with when he or she has UTI?
Me, I think it will depend if you're sure of the microorganism you're tackling. Because if you're giving fluconazole, then it means you already you are aware there's a fungal infection. But if it's specifically bacterial UTI, then the fluconazole will not be of help. But if it's a mixed infection, then fluconazole and antibiotic would work.
Okay.
Anybody else?
I think we can move.
Which one of the following viruses is associated with Burkitt's lymphoma? Hepatitis C, Epstein-Barr virus, Varicella zoster, or measles?
One is EBV.
Yes, Epstein-Barr virus.
Okay, let's recall ourselves with the Burkitt's lymphoma.
Pardon.
Let's just go through the whole Burkitt's lymphoma. It's
Oh, Burkitt's lymphoma.
yes. If yeah.
Okay, what I know about Burkitt's, I'd say it's a childhood malignancy, one of the childhood malignancies. And it's associated with infection with the Epstein-Barr virus. Maybe usually the cervical lymphocytes are the ones that are, or rather in the cervical lymph nodes, you will usually be the ones commonly affected where we see swelling around the cervical lymph nodes. That's as much as I know. I know Chai can take over from there.
Mostly occurs in children, right?
Yeah.
Is Divya here?
I think
But that Divya did her research
I
on
think
this.
this is what Divya did for her.
What I can also remember is that it's one of the DNA viruses, the herpes viridae. It is the strain of the herpes viruses, so it's a DNA virus. As you've said earlier, common in children, and more associated with things like mononucleosis. I think the issue of infectious mononucleosis will be more because of the issues of antibody production due to the virus itself. Yeah.
thank you. Okay, signs and symptoms maybe.
I think there's that swelling of the lymph nodes. The other one could be infections with like a kid. You're seeing a kid, they're always getting infection because this mainly affects their immunity. So yeah, recurrent infections. Yeah, recurrent infections, I think the word.
Infection. Then we have abdominal mass. Yeah. Wait, Burkitt is non-Hodgkin's lymphoma, yeah?
Yeah.
Yeah.
Wait, non-Hodgkin's like how?
I thought it was like, I don't know if it was, I remember it was somewhere around. Is it like a subclass or something?
Mm.
I'm
Yeah,
not sure.
Oh, me I got like non-Hodgkin's lymphoma is, but yeah, but I think it's a subclass. Now that you mentioned,
I don't know, somebody can correct us.
You're right, Nani.
it's a subclass. Yeah, Shrina, it's a histological subtype of non-Hodgkin's.
Okay.
Yeah.
So Does anyone want to add more signs and symptoms?
See, the other ones could be non-specific, like nausea, vomiting.
Yes, definitely.
I think the most prominent sign is someone has already written it down in the text on the chart that we find the swelling. The first indication will be the swelling around the neck or around the glands because it involves the lymphatic system. So one of the most prominent signs will be the swelling.
Yeah, which is painless.
Treatment, think you okay? The treatment is cytarabine, doxorubicin, etoposide methotrexate, and vincristine.
Yeah. Chemo, yeah.
Yes. Anyone else wants to add anything? Okay. Moving on, the mode of transmission for hepatitis A virus is oral fecal droplets, mosquito bite, sexual intercourse. For this, I remember, I think, guys, you did a nice table for this. Could you remind us with the different classes of hepatitis and
So we have Hep A, B, C, D, and E. A, B, C, D, E. So Hep A and Hep E, they cause acute hepatitis, and they are transmitted via the fecal oral route. Hep A and Hep E. Then Hep B, yeah, E for entomology. Then Hep C, D, and E, they, of course, now here, chronic hepatitis, B, C, D, but now Hep D is an incomplete virus or immature virus. Hep D only occurs in the presence of Hep B. It needs Hep B to give it its envelope. Yeah, just a second there.
mode of transmission?
Then now the other thing is all the hepatitis are RNA virus except for Hep B. Hep B is a DNA virus. So all the others are RNA viruses except for Hep B, which is a DNA virus.
Except Hep B.
Yeah, Hep boy. Yeah, Hep boy. Yeah. Then now for, of course, now for Hep C, Hep B, and Hep D, it's transmitted through blood products, and also it can be transmitted sexually. And also for Hep B, for some reason, men who have sex with men are more at risk of getting Hep B. So try, just be safe.
Treatment or signs and symptoms?
Or signs and symptoms now, for signs and symptoms is just, they are all general. For liver what? Liver disturbance. So we will see pale stools, we'll see dark urine, and we'll see jaundice. Pale stool, dark urine, and jaundice. Yeah. Pale stool, dark urine, and jaundice. Yeah.
Obviously,
For,
fatigue.
yeah, fatigue, malaise. Yeah. Those ones are also there.
Abdominal pain will come, yeah? because of the liver side.
Yeah, right upper quadrant tenderness, which we can progress to pain. Yeah.
Also loss of appetite.
Loss of appetite. Then now for treatment for A&E is just supportive, nothing much there. Just supportive. But now for A&E, yeah.
Yes.
And then but for Hep B and Hep C, now those ones we treat with drugs. Of course, we don't. When you treat Hep B, you've also treated Hep D, because we've said Hep D can't exist without Hep boy. Yeah. So Hep B, we have stuff like tenofovir, the same tenofovir that is used as an ARV, just given here. Now for this one, duration of treatment, sometimes it can be lifetime, it can be 48 weeks. For that one, it depends on a lot of parameters, lab parameters. So let's just put it at tenofovir. Then for Hep C, now there are these oral antiviral agents. I know there's sofosbuvir, and I think combined with naltrelvir. That one is let me confirm those. But to find this drug, pardon?
Acyclovir.
Oh, acyclovir is for herpes.
Oh yeah, herpes. This is sorry.
Yeah.
But also 3TC, that is lamivudine, is also used in hepatitis B. And also the alpha interferons, they are also useful.
So you can just write this. So let me text it on the chat. But it's usually given in combination with another drug. I'm forgetting the name. Someone remembers. It's something like that. So sofosbuvir or something close to that.
For Hep C.
Yeah, for Hep C, yeah.
Leila has shared a picture for us.
Laila, you're the best. You're the best.
For C, we can also use ribavirin for hepatitis C.
Sorry, I didn't get you.
I was saying for hepatitis C, also ribavirin is useful in treatment, in management, hepatitis C. Ribavirin.
Yeah, ribavirin.
Like that.
It is RBARINI, ribavirin.
RI?
RIBAVIRIN.
Oh, okay, got it. Good.
I think that's it about hepatitis.
We also have vaccines for hepatitis A and B.
Yes.
Oh yeah, vaccines, yeah.
hepatitis A and B.
Thank you. Okay. Anything else anybody wants to add?
Just something to note on ribavirin, because we mentioned it, is that it's contraindicated in pregnancy because I think it can cause abortions. Yeah. But I'll confirm if it's abortion. Just confirm. No, it's teratogenic. It's very teratogenic, and it can kill the embryo. And for women who desire to be pregnant, they need to, after using ribavirin, they need to stay for 6 months without without conceiving. Same for men. Even men need to go 6 months without their sperms making someone else conceive. So the use of ribavirin has highly reduced.
Okay. The following viruses causes latent infections except herpes simplex virus 1, cytomegalovirus, HSV2, or Coxsackie virus.
I think here we have Coxsackie because the herpes viridae family is notorious for causing latent infections.
So we could just add a point here that also the varicella zoster virus and Epstein-Barr virus is part of it causes latent infections.
Yeah.
Anybody wants to add anything? We go to the next. Antibodies are produced. Okay. Yes.
Atieno is talking about HIV. Atieno has texted HIV on the group chat.
So it's also part of the latent. Amma?
Yeah, she said yes.
Thank you.
You're welcome.
Okay. 66 is B because of the plasma which are produced from the B cells. 66 antibodies are produced from B cells.
Yeah.
Yes, yes.
I don't think we need to cover much on that. Lymphadenopathy is a sign of the following infections except African trypanosomiasis, toxoplasmosis, Kala-Azar, or schistosomiosis.
I don't think lymphadenopathy is a symptom of bilharzia, but I'm not sure. But I'm not sure.
Okay,
Mistakes, Janet.
Okay, me, I would think Kala-Azar, because Kala-Azar is this is visceral leishmaniasis, usually in the cavities. It doesn't have much involvement of the lymphatic system, because by the time you're having lymphadenopathy, there's an involvement more of the lymphatic system. Looking at African trypanosomiasis, it has some involvement because it's hemophalangerate by nature. Toxoplasmosis is a protozoa, I'm not so certain. Then schistosomiasis, for schistosomiasis, if it is schistosoma hematobium, it has some involvement because it has to migrate from the site, going via to the bladder, urinary bladder, and at the end of the day, to land somewhere causing some lymphadenopathy. So I'll go with Kala-Azar, which is visceral leishmaniasis.
Anyone with a different view? According to ChatGPT, it's saying that it is not associated with African trypanosomiasis, which is a sleeping sickness, right? And it primarily affects the CNS and not directly to the lymph node enlargement. But the other three have, I don't know how reliable it is.
Okay, from what I've got, lymphadenopathy can be associated with West African trypanosoma, toxoplasmosis, and Kala-Azar.
Okay.
Trina, I'm using the textbook, and just give me one. I've confirmed African trypanosomiasis is there. Toxoplasmosis is also there. There as a symptom, lymphadenopathy is there. Then I just inform you right now.
It might be schistosomiasis because from
Yeah,
Google,
yeah,
Google,
even
it
in
doesn't have,
parasites, there are
yeah, it doesn't,
lymphadenopathies there.
schistosomiasis does not have lymphadenopathy. Schistosomiasis is the
Yes, so for
symptoms,
67, I
rash,
think
So yes, it has the lymphadenopathy.
fever, chills, headache, joint pains, no lymphadenopathy.
It does have lymphadenopathy, as Nami was saying. So sidhani hii ni niko na jibu.
Dr. Chai is saying the question has no answer.
Even left it as red. I don't know when we can. It's a confusing question. So should we go?
No? Use schistosomiasis.
Oh, now I'll do this.
I think we can move.
So, okay. Bushria bancrofti is transmitted by Simulium species, Quairosops, mosquitoes, or house.
Shrina,
Yes, yes.
maybe we can mention something about the other choices. What organism causes trypanosomiasis? What animal,
Yes,
things
sure.
like those.
Okay. So the first one. Transmitted by
I think for the African one, it's the seseflites.
Yes, sassafras is true of Glossina species. Glossina, the fly itself is a Glossina species.
how do you spell that? Like that.
Yeah, perfect.
This toxoplasmosis is by meat and what? Is that cat? That one.
It's a
Vector.
protozoa
Hmm.
transmitted by cats, specifically most of the
Yes.
cats.
Yeah.
The cats are the vectors for Toxoplasma gondii, protozoa.
Should we mention the root also?
It's thick or root.
Yeah, yeah.
Calaza is by sandy fly or phlebotomous species.
Which species?
Phlebotomous species.
Snails.
Freshwater snails.
Yes, snails.
And Kala-Azar is by the Leishmania species, like the actual whatever infectious agent. Leishmania donovani. And then schistosomiasis is the Schistosoma japonicum, Schistosoma mansoni, and I've forgotten the other one.
Okay.
Hematobium.
Yes.
Do you have any prophylaxis for toxoplasma? Cats.
Sorry, Shay.
I'm asking if there's a prophylaxis for toxoplasma, like any preventive measure.
Just wash your hands before eating. Or don't eat undercooked meat.
How will you know where your cat has been? It was licking your plate.
I don't know how to help you and your cat. Keep your plate away from the cat. Wash your food properly. I think the main thing is you wash your hands. If it's fecal oral.
Maybe a little addition on schistosomiasis. You're saying we have like 5 different species, but as you're looking, you're having a Schistosoma hematobium, japonicum, and mansoni. And predominantly, the hematobium will be found within the urinary bladder. That's why most of the patients will have blood in urine. But mansoni is usually found on the colon or the large intestines, and the japonicum on the small intestines.
I have a question. Which of the species of schistosomiasis causes petechial rash?
I think the hematobium one. I'm not sure.
For the not even petechial rash or more swimmer's itch, or the other term for it is the sacral dermatitis. It's not even as a result of the schistosoma itself. It's as a result of the area that invades, that penetrates the skin when during infection. So that one is not specific for a schistosoma. It happens during infection, during that secarial penetration of the skin. That is what results in that maculopapular rash.
So you can anything else?
I think we should also look at the treatment.
Yes, sure. You can take us through, or maybe the common. What's in the chat box?
Somebody has added on the chat box that Katayama fever is from schistosoma, which is true. And maybe I wanted to contribute on management of one of these, like African trypanosomiasis. Usually we give, I'm not so sure, but you can check suramin or pentamidine.
Pentamidine and both. So for
Thanks.
the Gambian one, you give pentamidine, and for the Rhodesian one, you give suramin.
Thanks.
Mm-hmm.
Yeah, somebody has also indicated Meraspro for CNS trypanosomiasis. Meraspro for the one which has entered in the CNS. True. Thank you.
Mm-hmm. Mm-hmm. Okay, then for toxoplasmosis.
For toxoplasmosis, we can use pyrimethamine and sulfonamide. Also atovaquone, it's useful.
Isn't it a combination with sulfadiazine?
It is pyrimethamine and sulfonamide, any sulfonamide.
Mm-hmm.
And then onto the regimen, we're also adding the levolinic, or rather this form of folate. What is it called?
Folic acid.
To supplement.
Folinic acid.
It started with L.
Leucovorin.
Leu-
Leucovorin.
Leucovorin, yeah, leucovorin. Yeah, to supplement the folate deficiency that will be brought about by the pyrimethamine.
So this is for toxoplasmosis, not. Mm-hmm. Kalaza.
For Kalaza, we are given the what you call pentamonials plus aromomycin for 17 days. The sodium something. This
Sodium stibogluconate.
yes, tibogluconate, yeah, plus paromomycin. I'm for the
What is this in here? Mhm.
I'm not sure.
Umefanya local sasa hivi imekuwa vizuri. Imekuwa ya ukitaka kusort hizo maishu za property, ukitaka kusukuma review paper. Kazini yako kama vipi? Hao watoto walikuwa hapo nje nao?
Ni wa sister yake Msuku.
Mhm. Kwa sababu wanakaa pamoja.
But the husband doesn't stay there.
Mhm.
He lives separate.
What do you mean?
Because now it's a 3-bedroom house. There are 3 siblings. The first born, the way akona 2.
In Kalaza, you can also give meglumine antimoniate.
Please spell for me that. Write it on the chat, please.
Megumen is MEGL MEGLU GL. There's no A. There's MEGLU MINI. Then antimonate, because as Spider-Man said, we are calling them pentavalent antimonies. So even sodium stibogluconate is among the pentavalent antimonies, together with meglumine antimonate.
Okay. Thank you. Treatment for this. Praziquantel.
Yeah, actually, it's a drug of choice, praziquantel. Sure.
Okay. Should we go on to the next question?
Irregardless, Shrina, irregardless. We can now run. I think we've summarized half of parasitology.
Yeah. So Wucheria bancrofti is transmitted by I think this one is mosquitoes. Correct me if I'm wrong. Does anybody have anything to add on? Okay, which of the following does not have a blood stage in the life cycle? A. Lumbricoids, Necta americanus, strongyloids, and Pterobius vermicularis.
I'll go with the Enterobius vermicularis. This is a pinworm. Looking at the first three, they usually have to, it's transmitted via orophycal, like ascaris. And after ingestion, they have to migrate via the intestinal wall, go up to the lungs, where they are coughed again, and then they are swallowed again. The three of them have the same characteristics, but Enterobius vermicularis, the pinworm, usually is located locally at the anal area. So that's why I would go for that, unless if someone has a different suggestion.
In number 68, option B, the chrysops are used to spread the lower disease. Just to add on.
Thank you.
Please also add for Simulian species on the same number 68. Someone has already chatted it there, that it causes Onchocerca vulgaris.
Mhm. Okay. Should we move on to the next one if nobody has anything to add? Okay. Hematuria is a sign of which of the following? We've just talked about this. So hematobium. All the following may cause muscle. All the following may cause muscle atrophy except undernutrition, old age, innervation, and disuse.
Innovation.
Does anyone want to add anything? Opsonization is enhanced by which of the following complement components? C3A, C5A, C3B, or C2A? Personalization.
I think it's C3B.
Okay. Can somebody remind us of this complement pathway?
Not C3B? Yes, C3B.
Someone kindly take us through the complement pathway. Or the complement system.
What I remember something so little is that it is more of a proteolytic cascade, whereby it starts with an inactive precursors, which are activated as the process goes on with the aim of either destroying the cell or destroying the microorganism, the antigen, which is causing the infection. We have three pathways. We have the classical pathway, we have the alternate pathway, and the lecithin pathway. I'm not so sure of the components of the CA3A, CB3, but what I'm sure of is like we have the classical pathway relies mostly on antibodies, but the alternative pathway does not rely on antibodies. Yeah, and yeah, generally that's what I can remember.
Mm-hmm. C3A and C5A is for inflammation. And that. Yeah. I think we should just finish there. Reduction in serum albumin level is caused by all the following except nephrotic syndrome, liver cirrhosis, malnutrition, or heart failure.
Also, Shrina, you can add the three pathways in the chat box.
Yes.
Also,
Fatima.
the complement pathway is activated through three pathways. There is the lectin,
Yes, yes.
alternative pathway, and the classical pathway. Maybe someone can enlighten us more on those.
Okay, so maybe something about the classical pathway is, as Dr. Karimi had said, it's antibodies, IgM and IgG. And another question that comes from this, between IgM and IgG, IgM is more effective in activated complement, because IgM is a pentamer and IgG is a dimer. Yeah. So those IgM, IgG, there's that FAB portion and FC portion. So the antigen is bound to the FAB portion. So the FC portion will bind to a protein known as the C1q. That is what starts that cascade. That C1q, it will activate the C1R and S, which will cleave C4 and C2. And through C4 and C2, we'll get our C3 convertase. C3 convertase cleaves C3. And then we get from that combination, we cleave C5. Then C5A is for chemoattractant, inflammation, anaphylatoxin. And then C5B all the way to C9, that is what will form your membrane attack complex. It will punch holes into the surface of the antigen, whether it's bacteria or whether it's a molecule or something. Yeah. Then for the lectin pathway, or the mannose binding lectin pathway, here is more of this lectin. Lectin will bind to mannose, which is found on the surface of pathogen. So lectin will bind to mannose, which is found on the surface of pathogens. Then after that, it will again through a series of molecular associated surface patterns, something like that. Not so sure of the intermediate there, but again, we will form our C3 convertase. From our C3 convertase, the story becomes the same. C3 convertase, it breaks down C3 to C3A and C3B. Then C3A is added to the complex and it becomes C5 convertase. C5 convertase, C5A, C5B, C5B to C9, membrane attack complex again. Yeah. For the pathogen, for the alternative pathway, here is whereby pathogens or even injured tissue will release a factor B. And then that factor B was somehow acting as a C3 convertase. For the alternative pathway, that one, I'm not so, I don't know how to explain it because I've not really memorized it that well. But I know it has to do, it starts with a factor B. So for alternative pathway, factor B will somehow activate or will end up being the C3 convertase. Then C3 convertase again to C5 convertase. We get C5B to C9. That is our membrane attack complex.
Thank you so much, guys.
Welcome.
Reduction in serum albumin level is caused by all the following except nephrotic syndrome, liver cirrhosis, malnutrition, heart failure.
I'm thinking heart failure.
I don't think it has a answer here.
Why?
Because
We can eliminate A and B, right?
yes.
So C versus D.
It's saying some people with acute heart failure develop low albumin levels, but it's not well understood. The reason is not well understood.
But now for malnutrition, especially for a disease like kwashiorkor, it's a like that one. It's not a rare occurrence, so that's why I'm thinking D is the best answer, because malnutrition, we definitely see a lot of cases of hypoalbuminemia due to malnutrition. Yeah, the legend is also saying that the answer is D. I don't know why people are joining with pseudonyms.
Maybe also infection and inflammation can also lead to production of albumin.
Which of the following is a specific autoimmune disease? Rheumatoid arthritis, SLE, dermatomyositis, and Hashimoto's thyroiditis. Aren't all of them autoimmune? I don't know.
I would go with Hashimoto's thyroiditis because it affects specifically the thyroid gland. Because when you talk of specific autoimmune disease, it's an autoimmune disease, but specifically affecting a specific organ. If you look at rheumatoid arthritis, it will affect several organs at several areas, not a specific place. Same to systemic lupus erythematosus. Even dermatomyositis will be like a whole part of the skin on different areas. So I'll go with Hashimoto's thyroiditis.
Yeah. Makes sense. Anyone with a different view?
I think that one is C, the microcytic hypochromic RBCs.
Yeah. Fish tapeworm is associated with megaloblastic anemia, hemolytic anemia, iron deficiency anemia, or normochromic anemia.
That one is megaloblastic.
Yeah.
Hemophilia A is due to deficiency of clotting factor. Hemophilia A is due to deficiency of clotting factor 5, 6, 7, 8.
8.
Yes. The major intracellular cation is potassium, sodium, calcium, or copper.
Potassium.
The activation of vitamin D takes place in the lungs, kidneys, brain, or intestine.
God, them kidneys.
Leave. Oh, okay. Kidney.
Kidney.
Kidney. Oh, does anyone want to add anything on the fish tapeworm or iron deficiency? Anemia. Hemophilia B is associated with factor 9.
For IDA, see the management is and supplementation.
Oh. Kindly repeat.
I was saying about 75 management of IDA by Tony. Then we could maybe look at the others, pernicious anemia.
See here, you can give. Is this what you said?
Yeah.
Sulfate or gluconate.
Hemophilia A can respond to desmopressin treatment, but we can't use desmopressin for hemophilia B. That is for mild cases though. We use desmopressin for mild cases. Hemophilia A, mild cases, yeah.
Dr. Noor, could you kindly explain why we use desmopressin? And we know desmopressin is the synthetic form of ADH.
It usually temporarily increases factor 9 levels.
9 or 8?
And what is it called? The factor deficiency of hemophilia A. 8, sorry, yeah. Other than that, I just know it increases the levels. The mechanism, I'm not sure.
Okay.
Also, you can add hemophilia A is more common and B is less common.
And hemophilias, they are for dudes, right? Chicks don't get hemophilia, Ama? I'm asking medically. It's not a joke.
I don't know. I thought it's the opposite. I don't know.
No, I think it's for dudes. Dudes, we really go through it when
Okay, guys, I've searched. The internet says the desmopressin is used for several reasons. One, because it helps in release of stored factor 8, that is in it helps in release of stored factor 8 from endothelial cells. So that will help in increasing the levels of factor 8 temporarily in the blood. So it can be just used for mild cases and not for the moderate, for severe cases. And then also it helps in treatment of bleeding episodes in hemophilia A. And the third reason is it helps in that it reduces the need for factor 8 concentrates to be used in hemophilia A treatment. I don't know if it makes sense. Like desmopressin is an option before we turn to the factor 8 concentrates.
Thank you so much. Thank you so much, Nugal.
Okay.
Yeah, can we just go through the whole hemophilia? If everyone is okay. You know, hemophilia is X-linked. And then
The other thing about most common symptom is bleeding. That's the one thing I know. The only thing I know.
no. Bleeding.
Then hemophilia A is also called classic hemophilia. Hemophilia B is called Christmas disease.
Class.
Hemophilia is a classic hemophilia.
And this is Christmas.
Yeah, hemophilia B is factor 9, that is Christmas disease.
Mhm. Mhm. Diagnosis, you just do a blood test.
At what about a blood test?
I'm saying that you do a the diagnosis is you do a blood test and you see the amount of plasma.
Oh, yeah. You just check the levels of the factor 8 and factor 9. Yeah. But clinically, as you've said, you can't distinguish between the two clinically. You have to do the blood test to know whether it's A or B.
On treatment for hemophilia B.
For hemophilia B, I think it's factor replacement also. And I know also for both hemophilias, there's also use of the tranexamic acid because they are also anti-fibrinolytic agents. So hemophilia B, I'm seeing a factor 9 replacement.
Maybe hemophilia C is factor 10, right? Deficiency, we might add that.
Oh, there's a hemophilia C.
Yeah, I think there's until they're up to which type? I think, let me confirm.
Cool. I know there's also the von Willebrand disease, whereby the von Willebrand factor is deficient.
Also parahemophilia, deficiency factor 5, parahemophilia. It's called Orange disease. Let me just write in the chat.
And then the other thing to note with hemophilia is pain is also a very common symptom. And for the pain, we treat it with paracetamol and opioids, the good stuff, the opioids. We don't give them NSAIDs because the NSAIDs, they increase the risk of bleeding. So for a patient with hemophilia in pain, you don't give NSAIDs. It's either you give paracetamol or you give them opioids. But COX-2 inhibitors, the kinacelecoxib, etoricoxib, they can be used, but still not the best. Just give an opioid.
Even you can't use aspirin.
Hey, aspirin, it's an antiplatelet, and this person already has an issue with clotting.
Okay. Hemophilia. Hemophilia B can be treated with hemogenics 1. Is factor 11. Hemophilia is 10 or 11. Please confirm.
10.
Do we want to add anything about the iron deficiency anemia? Okay, I'll just continue. I think we can finish this 20 questions. Hyperthyroidism is characterized by high levels of elevated TSH, reduced T4, reduced 3, decreased TSH, elevated. I think the answer would be high levels of.
Yeah. So yeah, it's C.
3 and decreased. Yes. C.
Yeah, Tracy, yeah.
Which one of the following best describes the chemical structure of urea? Carbazide, carbazone, oxime, and carbamide.
I think here it's carbamide. Because the other name of hydroxyurea is hydroxycarbamide.
Choose the least acidic compound from the following. How do you work this out?
I'm also thinking benzene, but I'm not sure. Even the legend is thinking benzene.
Maybe an explanation, please, if there is. What made you think of B? I have no thought. I don't know. I'm blank. But what made you think of B?
Okay, for me, it's the it didn't have an OH group.
Okay.
Chemistry, yeah. So, like, okay, based on the structures, okay, for D, because of that chloride group, chances of it being acidic are high. Then for choice A, the same. So I remain with choice B and choice C because choice C is an amine. Choice C, like we have an amine group and an amine group is basic. So, but because of the OH also on that structure on choice C, that's why I went to the choice B. So, but let me see if our champion of chemistry is in the meet. I can request her to unmute and explain. She's not here. She's not here. But it's just a guess at the end of the day.
Shall we move on?
Regardless.
Geometric isomerism is usually found in alkanes, alkynes, or aromatics.
I think it's in alkenes.
Yes.
Maybe you can tell us about the types of isomers, constitutional. I don't know if Dr. Diana is here. She's a champion of isomers. Dr. Diana is here. She can tell us something about isomers, the different classes of isomers.
Is it me?
Yes, please. Yes, please.
Oh, okay. So, we have constitutional isomers where It's the same molecular formula, but different connectivity. Then we have stereoisomers. Yes, stereoisomers, it's same molecular formula, same connectivity, but different spatial arrangement of the atoms. Yeah, but all the others are the same. Then for just a class of stereoisomers, now we have the enantiomers. Enantiomers, it's the RS configuration, let's call it that. And it's the Kern-Ingold Prelog system. That's what they use to designate the RS configuration. Then there was optical isomers, I think. Optical isomers was for the D and L. Yes, and I forgot to mention for the stereoisomers, enantiomers, then diastereomers. Diastereomers are also a class just below stereoisomers.
Sorry.
The diastereomers, D-I-A-S-T-E, yeah. The diastereomers are the cis strands.
Okay, so should we call it the night? We're done, so that we can do the rest tomorrow. Amma?
Sure.
But we can just add a bit on the vitamin D activation and hyperthyroidism.
Yeah, that's okay. That's okay. Yeah, can I add a bit on that? I think recently Dr. Karimi was talking about activation of vitamin D and how it was happening in the liver and the kidney. Yeah, I think she's the best person to tackle on vitamin D.
Honestly, I can't like remember the exact pathway. What I know is that the active form of vitamin D usually occurs in the kidney, whereby you're changing the cholecalciferol to 125 dihydrocholecalciferol. But remember, usually started from the skin, the vitamin D, we can then there's a pathway. But what I know is that in the kidney, it is activated to the active form, that is 125 dihydrocholecalciferol. Yeah.
So do you know if is it the 1 or the 25? Because one of them
Means
is in
the active one is the one having the dihydroxy. 121,25 dihydroxy is the active one.
Okay. Yeah, maybe if I can add just something on that, is that in our body we have the dehydrocholesterol, which is obtained from cholesterol, and once the skin is hit with UV, it converts that dehydrocholesterol to cholecalciferol. Then the cholecalciferol will, first of all, it will go to the liver, and it will become the 25 hydroxy vitamin B3. And then it finally goes to the kidney and becomes 125 dihydroxy vitamin B3 or dihydroxycholecalciferol. So the hydroxylation at position 25 occurs in the liver, but the hydroxylation at position 1 occurs in the kidney. Yeah.
Thanks.
So if I may ask, so those with kidney dysfunctions, we give them the active, the already active form, right? Because they can't do the conversion.
Yeah, we want to give them calcitriol, which is the active form.
Okay.
Yeah. Then someone can finish us off with hyperthyroidism.
Weight loss. Let's look at sign and symptoms. This is weight loss.
Weight loss, diarrhea, tachycardia.
Is it, does the person feel hot or cold?
Yeah, they feel hot, intolerance to heat. We're expecting enlarged thyroid glands. Yeah. Fatigue, yeah.
Muscle weakness.
I think EK, I think he has a point. Kagume. I think he keeps unmuting, but then he mutes. We can go to, for diagnosis, it's the the answer from choice choice C, elevated T4 and T3 and decreased TSH because of negative feedback. Dr. Berry has given us a mnemonic.
Thank you.
Maybe the causes, like Graves' disease, those ones. Okay, there's Graves' disease, there's thyroiditis. There's, I think, also the toxic nodular goiter. Maybe someone can correct me if I'm wrong.
Let's finish treatment and then we can call it a day.
Nugal has already talked about the beta blockers because, yeah, most of the symptoms that we've seen, they're mediated by the beta adrenergic system. So things such as tremor, anxiety, yeah, the tachycardia, and the antithyroid drug, the methimazole and capimazole, yeah.
Also, if it's left untreated, it can cause thyroid storm, which is a life-threatening condition.
The other thing is that the PTU, propylthiouracil, it's safe. It's, or rather, it's the first line for pregnancy in case of hyperthyroidism. PTU is safer, at least in the first trimester. In the second trimester going on, the patient can now be switched to the methimazole, but with close monitor. But PTU is safer.
Yeah, everyone, I think. Anybody else wants to add anything? Thank you, everyone. Have a good night.
Same.